Dr. Drew. Today we're going to do a procedure called fat transfer to the face. We're going to numb up a little area of the patient's body. Then we're going to do liposuction in that and harvest some fat. We're going to mix the fat with some of her PRP, which we'll explain in a minute, and then we're going to re-inject it in areas of her face to give her a more full volume face. The problem as we get older is that we lose volume in the face. We get sunkenness here in what we call the malar areas particularly. So a lot of people, they'll see this hollowness in their eyes, they'll see sunkenness here. Well, we can plump that up with the use of fat in this area. We can also put some fat in the area we call the nasolabial folds, and right here in the chin area we call the commissures. That will help plump it up. The lips can be enhanced a little bit with the fat transfer too. The procedure is done while the patient is awake. We can put this patient to sleep if she likes, but most of the time mild sedation is all that's needed, and then a local anesthetic. So again, what we're going to do is we're going to do some liposuction, harvest the fat, and then re-inject it in her face. We mix the fat with something called PRP, platelet-rich plasma. Platelet-rich plasma is the person's own blood. We spin it down and we get the platelet-rich plasma part that has growth factors. The reason why we mix it with the fat is because the growth factors will stimulate the growth of the vessels. We want the vessels to grow into the fat as much as possible to feed the fat. Otherwise, the fat can go away. Therefore, there's better survival if we use the PRP, platelet-rich plasma, for the patient's blood. The result is that the patient's face has a more fuller volume, like when she was a younger woman. Young people, if you look at them, they have fullness in their cheeks and they look more vibrant. With the PRP, it stimulates the vessels to grow, so there's more of a color there, a good natural color. And that's what we want to have, is a beautiful face with nice volume and a brightness to the face. So let's get started. Okay, we're back here. We have numbed up the belly and the lower abdomen nicely with the tumescent fluid. Now we're going to do liposuction on this using just a syringe liposuction to collect and harvest the fat. We use small little cannulas with some special holes in them to do this in a gentle manner. So we insert the cannula inside and just pull the plunger, and it sucks out the fat in a nice, easy, gentle fashion. We're going to get about 30 to 40 cc's of good fat, mix it with our PRP, and then re-inject it. As we can see here, we have collected a syringe full of the fat. Now we'll let it drain a little bit. We'll collect that and mix it with the PRP. Patient has had some trauma to her face, so we're going to try to bring that dent that she has in her face out with the fat transfer. To insert this PRP with the fat inside these areas we've numbed up. Here's the area that really needs a lot of fat. We call this the malar area. I put a lot of fat in this area here. And then this area here is called the nasolabial fold. Kind of put some fat in this area too to pump that out. Plump this area as much as we can. This area that she had all this trauma. And then here is the temple area, which a lot of people, they have a reduction in their fat as they get older, and this needs to be plumped up to get a better volume in this area. What we call the commissures, this area right in here. Fill them up a bit. And we'll also do the lower lip a little bit here too. Now what we'll do is we'll do this other side. We've already done most of this side. You can see there's quite a lot of volume that still needs to be filled in over here. Well, we've done good filling in of volume in these areas here. This will be filled in just like here, and it'll make it nice and even. We'll put the same amount on one side as the other side. Start off with malar area here. And small little holes. That completes. The patient did very well. Come back to see me within a day or two. Kind of take it easy for about a week, but then after about a week, she can go back to most normal activities. Now, I'm Dr. Robert True. Thank you for watching.